manufacturers on how that will work.
Thank you.
Thank you.
Move to Senator Tuberville.
Thank you very much. Just very quickly, I know there's plenty of misinformation on both sides, when it comes to COVID, but I would say this, the fear-mongering on the left is, and I'm going to give you a couple of questions here about this, has made the matter as much worse. Dr. Fauci, I just want to ask you this for my constituents back in Alabama. Ivermectin, 40-year drug. Now, my constituents read this. They hear about it and all this. 40-year drug. They call it a wonder drug. It's about a nickel a tablet. It's done wonders supposedly in India and several other places. And then you have this new antiviral pill that we're coming out, and my constituents saying, this thing's going to cost $500, $600, $700 each. Could you give me a rundown on between the difference in those two, what you think about them, get it on record here so I can tell my people back home, this is what Dr. Fauci says.
Sure. So Paxlovid, the drug from Pfizer, has shown in a randomized placebo-controlled trial to be highly effective to the point of 89%, almost 90%.
What's it called?
Paxlovid.
Okay.
It's made by Pfizer. And it has been shown in a very well-controlled, randomized placebo-controlled trial that if you take that drug compared to the placebo within the first 3 to 5 days, within the first 3 days, you have about an 89% chance of preventing you from going to the hospital or dying. There were no deaths in the Paxlovid group, and there were several deaths in the placebo group. That's Paxlovid. Ivermectin has had non-controlled trials suggesting that it might be effective, mostly anecdotal. The CDC, the NIH guidelines panel have looked at that data and felt there's not sufficient evidence to say that it works or it doesn't. The WHO recommends strongly against it and suggests that it might actually be harmful. The NIH active studies are doing a whole bunch of studies with ivermectin as well as others to try and settle it once and for all to prevent people from taking it if it doesn't work, because it could be toxic. So there's a world of difference between ivermectin and Paxlovid.
But this is a 40-year drug, and we're talking about one that's just now coming on the market. So we actually know that much about this Pfizer drug. I wish they'd come up with a lot easier names for their drugs.
Yeah, they always do that. They fool me too with the names, Coach, but
yeah.
It is what it is. The fact is, I think it's kind of a miscomparison to say one is a 40-year drug and one is a drug that was just discovered. It was just discovered, but it was shown in a very well-controlled clinical trial to be highly effective. Even though ivermectin is a good drug for some parasites, it has not been shown in a well-controlled, placebo-controlled trial to be effective in COVID.
Okay, thank you. Dr. Walensky, I don't know if anybody's asked this question. I just want to get it cleared up. Our Supreme Court Justice last week, looking into the situation with the mandate, Justice Sotomayor said there's 100,000 children that are sick as we speak with Omicron, and a lot of them are serious in hospital. Is that true or false?
I don't have the number of children in the hospital right now. It's likely less than 100,000.
Yeah, and Justice Breyer said that, that if we continue to delay this ruling, that we're going to have 750,000 more that are not vaccinated infected a day. I mean, does that make sense to you?
What I can tell you is our children between the ages of 0 and 4 are one of the only places where our hospitalization rates are currently rising, and that children who are in the hospital are generally unvaccinated, not uniformly, but generally unvaccinated. And that's true for not just our 0 to 4 who are obviously ineligible, but also true for our 5 to 11-year-olds as well as our 12 to 17-year-olds.
Thank you. Well, thank you all for being here today. Thank you very much. Thank you, Madam Chair.
Thank you so much. I have one final question for Ms. O'Connell, Dr. Walensky, and that's regarding education. In the past, we have seen school districts that serve a significant number of students of color or those in low-income or rural areas that are facing great challenges in accessing resources they need to serve our community.